Good morning. My name is Mark Truty and I'm a cancer surgeon, and I'm speaking to you on behalf of the Patient Experience Project of the AHPBA. Today we'll be talking about pancreatic cancer. Things have dramatically changed over the last 5 to 10 years in our management of pancreas cancer. We have significantly better drugs that are much more effective. We're also able to perform operations in a larger fraction of patients. Therefore, we highly recommend any patient who's been diagnosed with pancreas cancer to seek out a second opinion, particularly at a center that specializes in this disease. Common symptoms of pancreas cancer include weight loss, pain. Patients can become jaundiced or yellowing of the skin. They can develop diarrhea. They could also develop new diabetes or have a worsening of their previous diabetes. The overwhelming majority of the cases of pancreas cancer have an unknown cause. A very small fraction of patients can have increased risk factors. Those are typically patients with a significant family history or certain genetic disorders. But in general, over 95% of cases are sporadic or occur spontaneously. If you've been recently diagnosed with pancreas cancer, you need to be seen at a center and through a team of physicians that specialize particularly in this cancer. You'll be undergoing a variety of testing, including laboratory tests, special scans and imaging to take a look at your tumor, has it spread at all, and then meet with a team to determine your treatment plan. There are 3 primary treatments for pancreas cancer. These include chemotherapy, surgery, and radiation. All patients with pancreas cancer at some point are going to be requiring chemotherapy. Patients who can have an operation to remove their cancer can live significantly longer than those patients who cannot have an operation. However, there are 3 primary requisites to get a benefit of that operation. Number 1, you need to have a negative margin. So what does that mean? Whatever operation the surgeon performs, they have to completely remove the tumor without leaving any cancer behind. Second, we can't have any evidence of metastases or spread of the cancer. There's no significant benefit of an operation if the cancer has already spread to other organs. And third, the patients have to be in excellent condition to tolerate whatever magnitude of operation that is, so that they don't develop a significant complication that would prevent them from getting the chemotherapy that they need. Patients that are candidates for an operation, there are a variety of different techniques that are performed depending on where the cancer is located. Surgery can be performed in a standard open fashion. In some cases, it can be performed what we call minimally invasively or laparoscopically or robotically. Much of that depends on the expertise and the particular location of the tumor. Depending on the extent of the operation, most patients will likely be hospitalized for 1 to 2 weeks in the hospital, and then probably 2 months of recovery. And then depending on whether or not those patients received chemotherapy prior to surgery, some patients will also receive some chemotherapy after surgery. Depending on the type of operation performed, patients may have some issues, gastrointestinal issues, issues with absorption and the way they eat, and therefore we highly recommend operations being performed by specialists. Typically, patients completing their operation are going to be followed by their oncology team, typically every 3 to 4 months for their whole lifetimes to make sure that the cancer doesn't come back. So historically, there's been a really bad stigma attached with pancreas cancer. However, that stigma should be changing because of the improved therapeutics that we have and improved modalities who are leading patients who once had a very little chance to significantly improved outcomes. So we highly recommend seeking out a second opinion. Don't take the first answer as a final answer. Despite the diagnosis, life still goes on. We still have to take our kids to school. We still have to go grocery shopping. We still have to pay our bills. In the midst of all this, life happens. We're going to help you get through that. Let's work together.